Unnecessary Deaths: How the Trump Administration Undercut U.S. Healthcare and Medical Science, by Robert Coleman, M.S. Pharm. Foreword. Unnecessary Deaths exposes the chilling consequences of the Trump administration's healthcare and science policies, revealing how deliberate neglect and anti-science rhetoric have led to thousands of preventable deaths. Through a meticulous examination of data, expert insights, and personal stories, the book illustrates the devastating impact on public trust in science and global health. This urgent call to action implores readers to recognize the life or death stakes of U.S. policy on its citizens and demands accountability for the future. Introduction: The Cost of Policy Choices. This ebook examines a sobering question. How many lives were lost and will be lost due to the Trump administration's healthcare and science policies? We'll explore what unnecessary deaths means and how experts measure them. The dismantling of pandemic readiness before COVID-19 hit. How anti-science rhetoric fueled vaccine hesitancy, costing thousands of lives. The global fallout from Africa's measles outbreaks to cuts in U.S. research. The long-term damage, eroded trust in science and lasting policy backslides. This isn't about politics, it's about data, evidence, and consequences. In the face of unprecedented challenges, the past few years have forced us to confront a harrowing reality: how policy decisions can directly translate into lives lost. This ebook embarks on a journey to uncover the human cost behind the numbers, focusing on one critical question: how many lives were and will likely be cut short due to the Trump administration's approach to healthcare and science policies? Through data, expert analyses, and real-world stories, this ebook will delve into what it truly means to label a death as unnecessary and the methodologies experts use to measure them. The collapse of pandemic preparedness efforts and its devastating consequences when COVID-19 struck. The far-reaching effects of anti-science rhetoric, including vaccine hesitancy, that in turn claimed thousands of lives. The ripple effects felt globally, from measles outbreaks in Africa to the stalling of U.S.-led research initiatives. The erosion of public trust in science and the long shadow it casts over future policies. This is not merely a recounting of history or a tally of numbers. It is a call to reflect on the power of evidence-based policymaking and the weight of neglecting it. This narrative seeks not only to inform, but to remind readers of the lessons learned during this turbulent period and the imperative of safeguarding public health and science for the future. The story you just heard in this chapter isn't just history. It's a warning. And this warning is not over. The policies, the failures, and the human cost we've documented in unnecessary deaths continue to shape our world right now. If you want to understand what happens next, you need to see the full picture. On this channel, we're not just releasing the audiobook, we're building on it. We'll be diving deeper into the data, tracking the real-world impact of the policies discussed in this book. By subscribing, you're not just getting the next chapter. You're joining a community committed to learning from the past to protect our future. Subscribing is the easiest way to ensure you don't miss a single video. The next chapter drops soon. Here's what you can do right now. Hit the subscribe button Click that bell icon to get notifications so you know the moment the next chapter is live. Check the links in the description below to get the full ebook on Gumroad and dive deeper at your own pace. The most dangerous lesson we can learn from unnecessary deaths is to look away. Stay informed, stay engaged, and please, subscribe. Thank you for watching and for caring enough to listen.